A new report suggests health outcomes for Indigenous Australians may be improving. The Australian Institute of Health and Welfare has found there's been a 27% decline in premature deaths among Aboriginal and Torres Strait Islander people compared with 2 years ago. Dr. Jason Agostino is a medical advisor with the National Aboriginal Community Controlled Health Organisation and joins me now. Welcome to the program.
Hi, Dan.
I want to start with this report and go to COVID-19 in a moment, but how encouraging is this report?
Yeah, look, we've known about some of the improvements in this report for a while, and a lot of it is around the improvements in heart attacks and strokes and other diseases related to smoking. So I'm glad we're talking about it because it has been a really remarkable improvement amongst the community.
It usually, sadly, these stories are confined to how things are getting worse. It's what we usually hear at the annual Close the Gap address. Do you think that this is starting to turn things around?
Yeah, look, I think we're starting to focus on the improvements for Aboriginal and Torres Strait Islander people, and not just talk about gaps. So, we've seen smoking rates come down by over 10% amongst Aboriginal and Torres Strait Islander people. It's down below 40% now, and that going to have a huge impact for a long time on health. And we're seeing that start now with heart attacks and strokes, and down the track we'll start seeing that with cancer as well.
That just staying with that smoking drop of 10%, what do you put that down to? Why has that happened?
I think in the past 20 years, there's been a realisation that the policies for non-Indigenous Australians weren't working so well in the communication. And, you've seen some of the more mass media messages focused on the importance of community and your family, and I think messages that more resonate with Aboriginal and Torres Strait Islander people. Plus, on the ground, we've had a lot more workforce dedicated to tackling Indigenous smoking in communities. And we're also seeing improvements in access to nicotine replacement therapies to help people get off.
And we're repeatedly hearing from NACCHO, the organisation you work for, and other peak bodies around the country about listening to communities and having those direct conversations, which frankly hasn't been happening for so long. Do you see that starting to change?
Yeah, it is. I think the Coalition of Peaks, which is chaired by my CEO, Pat Turner, is really driving that. And in the National Closing the Gap agreement, there's 4 priority reforms, and the first one, and probably the most important one, is about genuine shared decision making between Aboriginal and Torres Strait Islander peoples and the government.
I mentioned at the start about that 27% decline in premature deaths among Aboriginal and Torres Strait Islander Australians. Is that going to have an impact on the life expectancy gap of about a decade between Aboriginal and Torres Strait Islander people and other Australians?
Well, there has been a small improvement in people's life expectancy, and that is attributable to this gap. When we talk about gaps, we've got to remember that non-Indigenous people's life expectancy is increasing as well. So we have seen Aboriginal and Torres Strait Islander people's life expectancy increase over the past decade.
And when you must be heartened by these results, what more needs to happen now and going into the future?
Yeah, it's really about focusing on the 4 priority reforms within the National Agreement on Closing the Gap. So shared decision making between Aboriginal and Torres Strait Islander people and the government, strengthening community controlled organisations, improving government organisations, and sharing data with communities so that they can have a real meaningful impact on the policy direction in their communities. So those 4 things are fundamental, and from that, and with greater control from the Aboriginal community, I'm sure we can continue to see these improvements.
Dr. Jason Agostino, I want to turn to COVID-19 now, and we've seen some really sad news this afternoon about an Aboriginal man from Wellington in regional New South Wales near Dubbo dying, the 9th Aboriginal person to die. I wonder what your reaction is to this.
Yeah, look, it's sad, and my thoughts go out to the family and to the community there. It's been an incredibly tough 2 months for Aboriginal and Torres Strait Islander people everywhere, but particularly in New South Wales and in the West and Far West.
Has there been enough of a focus on getting the right communications out into remote communities about COVID-19 and vaccinations?
I think there's been a lot of efforts to do that, but it's clear we need to continue to do more. there remains a lot of misinformation out there, as well as people not quite understanding how badly Aboriginal and Torres Strait Islander people have been impacted by the Delta strain. We're now up to over 3,800 COVID-19 infections amongst Aboriginal and Torres Strait Islander people. And that's basically all happened in the past 2 months, with Aboriginal and Torres Strait Islander people being infected at twice the rate of non-Indigenous Australians. So it's about, first of all, debunking that myth that COVID-19 does not impact Aboriginal and Torres Strait Islander people. As you said, we're up to 9 deaths now and close to 500 people hospitalised with it, as well as targeting more specific misinformation campaigns that have been getting into communities.
Do you worry that the rolling back of some of those restrictions that we've been talking about throughout today that Premier Perrottet has announced is going to have a detrimental impact on Aboriginal communities?
Yeah, I am worried. We know that whilst the vaccination rates have been improving significantly in New South Wales and ACT and Victoria, that there remains a gap. Amongst Aboriginal and Torres Strait Islander people in New South Wales, we just passed 70% first dose coverage for 12 and over yesterday. And so they're behind in the vaccination rollout. And this easing of restrictions means that those people that aren't fully vaccinated are at risk of getting COVID and spreading it to their community.
So what do you think is going to happen next week?
I'm not sure. I guess what we're here to do is to try and keep getting those vaccination numbers up as quickly as we can and support communities to access testing and to be able to safely isolate so that they don't spread COVID onto their family.
Oh, and that's been another big discussion. There was one family, I believe it was in Wilcannia, who were told to just get Uber Eats. They're 200 kilometres away from the closest town. There are other issues in that community as well. It made most people scratch their head and say, what's going on here?
Yeah, look, it's clear that, there's different responses needed depending on where people live. And for all Aboriginal and Torres Strait Islander people, the most important thing is that if someone has COVID or if they're a close contact, that they're offered safe accommodation where they can isolate without passing it on to their family members in their household. Too many people live in crowded houses, and we need to be able to offer those people appropriate accommodation for them to isolate.
At the start of this outbreak of the Delta variant, Dr. Agostino, there was a lot of discussion about vaccine hesitancy and whether that was higher or more exacerbated in Indigenous communities. What's been your perspective?
Yeah, I think as the issues with access have, virtually disappeared, it has become clear that there is persistent areas where vaccine hesitancy or vaccine complacency is really quite entrenched. So in those areas where they've been quite successful at keeping COVID out in Western Australia, Northern Territory, Queensland, for example, and also in younger age groups. So when we look at why there is a gap in vaccine coverage, it really is in the age group under the age of 40 where we see the biggest gaps. And, the Aboriginal and Torres Strait Islander population is young. The average age is 23. So we really need to be targeting information campaigns at that group and stress how important it is for vaccination to protect them. 1 in 8 people between 20 and 40 who get COVID end up in hospital. But it's also really amazing at stopping spread into your family and your community.
Yeah, such a powerful message. Dr. Jason Agostino, Nacho, medical advisor, GP and epidemiologist. Thanks so much for joining me this afternoon.
Thanks, Dan.